Board of Health, and Tim Shepard has graciously agreed to read and acknowledge.
So before we proceed, I would like to take a moment to acknowledge that the health unit resides on land covered by the Robinson-Huron Treaty of 1850, and that we are all treaty people. This land is a traditional territory of the Anishinaabe people and is also part of the unceded territory of the Algonquin Nation. I would also like to acknowledge the Métis historical presence in this region. I encourage everyone to think about how they may contribute to the process of reconciliation.
Thank you.
Go ahead.
So I'm looking for someone to move and second our agenda for this committee meeting today. Rick? And I'm looking for someone to second. Kathy? Resolved that the Finance and Property Committee agenda dated April 24th, 2024 be approved. For a recorded vote, Rick?
Yes.
Karen? Hook?
She's not here, Tom.
She's not here yet. Not here yet. Blair Flowers?
Yes.
Tim Shepard?
Yes.
Sarah Inch?
Not yet. 5:15, she loved it.
Okay. Jamie Lowry?
Yes.
Jamie McGarvey?
No,
Not
at
6
6.
yet either. Jamie Restuel?
Yes.
Myself, yes. Morris?
Yes.
Dave Wolf?
Yes.
Still.
Yes.
Motion is carried. Do we, if anyone comes across a conflict of interest during any part of our session, be free to let us know. Does anyone have one to declare at this moment in time? Seeing none. Move on to our presentation of our audit report. Derek D'Angelo from KPMG. Derek, you have the floor.
Thank you very much. I have two parts of the presentation. I have the audit findings report and I also have the financial statements. Is there any one you'd prefer me to start with?
I think you can pick and choose.
Okay, I'll start with the audit findings report. Did you have a copy of it handy, or do you want me to stream it for you?
You can stream it if you like for those that don't have a copy or have it pulled up.
Okay, thank you. So this is our audit findings report for the year ended December 31st, 2023. Main contacts with the engagement are myself, Derek D'Angelo, and my lead audit senior manager, Sarah Lingenfelter. So just going through some of the highlights, and again, the report is very short, so it won't take a lot of time to go through it. There are just a few things I want to talk about, and they are the ones that are highlighted in the pink bar. So one is the information system migration, and the other one is the corrected adjustments that are included on the management representation letter. So we prepared this report last week. So as it says, as of April 15, 2024, we've completed our audit, and we only have a few things left to be able to sign off for this year. There's just some certain other audit procedures to complete, and we do those once we've had these discussions. We have to complete our discussions with the Board and Finance Committee, and as well get approval of the financial statements. So really very few things left to complete we can sign off this year. So talking about control deficiencies, there are various types of potential for control deficiencies. There's internal controls, and again, various levels of deficiency. And again, we do not have any control deficiencies that we want to report to you this year. And as I mentioned as part of the earlier part, the only thing that really changed this year is that there was a new accounting system that was implemented during fiscal 23. Because of the change in system that occurred during the year, we actually do specific conversion testing over that system to ensure that the financial balances transfer over properly. So we did our specific testing and we did not identify any discrepancies and therefore have no other matters to report on that issue. So look at some of the communications. I'll go over this in more detail when I go over the financial statement, but this is an example of our auditor's report that is included in the audited financial statements. Looking at some other communications, we do have an engagement letter signed with the health unit that is available should anybody want to look at it. As well, these are all hyperlinks that are available if should you want to go and look at the inspection results for the audit committee, or for the audit committee wants to look at the inspection results of KPMG in the market. This is another document that we get signed. This is the management representation letter. Really here, this is just a test that management has fulfilled their responsibilities as part of the audit. When you go through and look at this, it really is a standard management representation letters. There's no modifications to this report. This is one of the things we get signed prior to issuing the financial statements. As part of that management representation letter, we talk about the summary of adjustments. There are two types of adjustments, one that we consider corrected and one that are considered uncorrected. And regardless of whether they're corrected or not, we have to report them because once we start the audit, we start with records that are that we get, and then any adjustments that are posted, even if client generated, we include on the management representation letter. So personally, I don't like the way these reports are titled because it calls them a summary of corrected misstatements. Misstatements is not really the proper word. Really, these are adjustments that management has brought to our attention that need to be adjusted after we begin our audit. So I look at this and I consider this more to be a summary of corrected adjustments. There were no misstatements that we want to bring to your attention. Anything that we ask management to adjust, they're willing to look at it, and these are adjustments that they brought to our attention that they needed to address post getting the books to start the audit. A lot of these are very standard ones talking about amortization of property and equipment. These are adjustments that are done every year after we begin. So again, I don't like the title here, calling it the summary of corrected misstatements. It's really just corrected adjustments. We talk about audit quality and that at KPMG we comply with ISQM1, which is the new international standard for quality management, which says that we have to follow a code of ethics and ensure that we're following the rules of professional conduct in completing our audits. And part of this audit quality is to ensure that audits are executed consistently and aligned with the requirements of applicable standards with a strong system of quality management. And we want to make sure that all our activities are undertaken with the utmost level of objectivity, independence, ethics, and integrity. We talked about these. We talked about some of these audit quality indicators as part of the audit plan. So we talk about whether we're going to rate them, green, yellow, and red. They're rated red only because they're different from what we expected, but not negative in any fashion. So the team composition didn't change. Again, I was still on engagement. I have 33 years in public practice, and Sarah has many years experience as well. We did use digital technologies as part of the audit. So again, we're getting towards using a more continuous or a digital audit, which we'll see, going forward. Timeliness of PBC items. Again, no specific matters report here. It's red only because, again, some of the items we talk about certain timelines, and but we had no issues with management. They were excellent, and we have nothing to bring to your attention here. We talk about quality reviews and whether or not your file was, the audit file was selected for inspection. And this would be based on the 22 audit, because obviously the 23 audit won't get inspected until 24 if it does, but it was not selected for quality review. And engagement hours, this is not necessarily a negative for the health unit, but we did have more senior manager time spent on the file than we would have anticipated. That has nothing to do with the health unit. It's due to the fact of our continual staffing challenges that we have in public practice. So all it means really is that you had a more senior person doing some of the audit work than would normally have been budgeted for. So again, from your side, that's actually a very positive thing because you have a more senior individual doing your audit for you. And again, as mentioned about the new standards, ISQM1, this is a quality management standard that all firms have to apply, and it has a pretty significant impact on how engagements are staffed, monitored, and managed going forward. So again, we follow all the guidance that's required as part of ISQM1, and our firm has to report on a quarterly basis how we're applying ISQM1 in our practice. And this last slide here really just talks about different things that are available to you as members of the committee, where you want to learn about different boards and how, the role of a board member, audit committee guides and things like that, just things to help as you fulfill your responsibilities. One of the things you probably hear in the news a lot is about climate change and how climate change may impact financial reporting. This is not an issue yet for entities such as the health unit, but I can see how it's being applied, that maybe in 5 years, there will be some commentary that's required in your financial statements about the impact on climate and climate change. But again, we'll bring all that to you when the time is required. So that's all I have for the audit findings report. And again, more than happy to answer any questions about that report before we move into the financial statements.
Do you have any questions or online?
Oh, okay. So I'll move on to the financial statements. I'll try to make this a little bit larger because I know sometimes it can be hard to see. So the first pages in on the financial statement are really the only pages of the statement that belong to KPMG. The rest of the financial statement are your financial statements as board members of the North Bay Prairie Sound District Health Unit. So the independent auditor's report really gives our opinion, the basis of our opinion, and goes over the various roles and responsibilities of both those charged with governance and management, as well as the auditor's responsibility in completing the audit. The important thing to know here is that we've given a clean or an unqualified opinion for your financial statements for the year ended December 31st, 2023, and your financial statements were prepared in accordance with Canadian public sector accounting standards. The basis for opinion, basically the important part here is that we conduct our audit in accordance with Canadian generally accepted auditing standards. And those are what we need to, those are the rules we need to follow when completing an audit for any Canadian entity. The rest of the report, again, it's about 3 pages in length. Again, as I mentioned, it lists those responsibilities of management and those charged with governance. And management is responsible for the preparation and fair presentation of financial statements in accordance with Canadian public sector accounting standards, and for internal control as management determines is necessary to enable the preparation of financial statements that are free from material misstatement, whether due to fraud or error. And the auditor's responsibility, it lists very much in detail of what our responsibilities are in completing the audit for 2023. Some of the other important things to note is this is an unmodified report. There are no changes from the standard auditor report, and it's the exact same audit report that you would have received in fiscal 22.
I think it opened.
So looking at the statement of financial position, this is a summary of your financial assets, financial liabilities, and accumulated surplus at a point in time being December 31st, 2023, with the comparative figures for December 31st, 2022. And again, just going to talk at a very high level here and in round numbers just to make things easy. So at year end, you had cash in the bank of around just a little bit over $4 million. Down from 6.2 in 2022. Yeah. And really the big reason here for the changes is there's about $1.2 million used in operating activities and around $995,000 used to purchase capital items such as furniture, equipment, leaseholds, and things like that. Accounts receivable has increased from $450,000 up to $1.65 million. The biggest pieces here for this $1.2 million increase, there's around $697,000 COVID-19 vaccine funding outstanding at year end, as well as $483,000 for capital funding for the Parry Sound building. So financial assets are down approximately about $1 million. A lot of it, again, is just due to timing of when those receivables came in, as well as purchasing capital without having any financing for it. Looking at your financial liabilities, as you can see, accounts payable and accrued liabilities very comparable to the prior year. So it's consistent. There is just a slight change in the mix with around a $200,000 increase in trade payables, offset by around $140,000 decrease in accrued salaries and benefits. Deferred revenue refers to funding that comes in 1 year that really relates to services that will be delivered in a future financial year. And that's down around $214,000. So really what it is we're actually delivered some services in fiscal 23 that we received funding for in 2022. Biggest pieces here is funding for the infection prevention. So some of those deferred funds were lower this year, as well as some for the Northern Gateway Hub, small changes, as well as the CHCI grant of $173,000. The payables of the province of Ontario, it's down approximately $1 million. And really what we see here is there was some surpluses set up to be repaid in fiscal 2022. So some of the big changes this year, again, we have some surplus funding in public health, around $135,000. A settlement of $473,000 for the infection prevention hub. Again, that was funding that came in 22-23. Some member municipality surpluses from the budget, around $62,000, and a surplus in senior dental of around $22,000. And the big change here is there was some prior recoveries that were settled. Again, you're in the MCSS programs. There's around $148,000 of some prior surpluses that were settled, and the big piece here, about $1.5 million of COVID vaccine funding that was settled during fiscal 23. Other employment liabilities really represents vacation pay obligations to your staff. That's the main part of it, and it's down around $66,000 this year. So total financial liabilities are down around $1.3 million. What is? We take our financial assets and we subtract our financial liabilities, and that gives us our net financial assets, and we're up around $280,000. Looking at your non-financial assets, the biggest one being your tangible capital assets, which are all your buildings, computers, furniture, anything of that nature. And really what we see here is really a small change, an increase of around $75,000 this year. As I mentioned, there's about $995,000 of capital additions this year, about $116,000 on computer equipment and software, approximately $40,000 on furniture, around $238,000 of equipment, and approximately $600,000 on leaseholds. And this was offset by approximately $900,000 of amortization or the accounting usage of those assets. And the remaining two financial statement line items, supplies, inventory, and prepaids, really small changes year over year. So what does it mean at the bottom here is that there was a small increase in your accumulated surplus of around $285,000, ending the year at $19.1 million. Looking at the statement of operations and accumulated surplus, really this is a summary of your revenues and expenses for the year. And again, just going to go through the highlights where there are significant changes year over year. So looking at your revenues from the province of Ontario, your core funding. So the first column is the budget. That's the budgeted amount, and the next two columns are the actuals. So as you can see, funding is in line with budget for both core and mitigation funding. It is up approximately $585,000 from the prior year. There was an increase in funding for the Ontario Seniors Dental Care Program of around $476,000 and around $115,000 of increase in funding for the public health mandatory programs. Mitigation funding was exactly the same as last year and in line with budget. One-time funding, though, you do see it is down about $2.6 million from last year. Last year, there was approximately $467,000 decrease with the COVID-19 general program funding, about $1.9 million decrease in COVID-19 vaccine program funding, and then some other decreases, about $350,000 decrease in the school-focused nurses initiative funding. The next three are very quite comparable to last year, so really nothing to bring to your attention. When we get down to the third last revenue line, or other grant revenues, we can see that that's gone down from $951,000 to $357,000. And really this decrease is largely due to the 2022 isolation center funding. The project was completed in the prior year, and therefore there's no funding in the current year. Interest and other, you can see, is almost doubled from the prior year. We all know what's happened with interest rates in 2023. So there's a lot. We're seeing any entity that's has significant cash balances on hand has been able to generate significant interest revenue in 2023. And our transfers to deferred revenue really results in the differences of our transfers between our deferred revenues, and which I've talked about a little bit already, and that's $214,000. So your revenues are down from the prior year by about $2.5 million, but they are above budgeted amount by about $1.4 million. Looking at the expense by program, the biggest ones here, again, looking at the public health mandatory program, the expenses are down approximately $511,000 from the prior year. They are up from budget, though. And really the decrease here is about mainly to do with salaries and benefits related to the COVID-19 staffing. Ontario Seniors Dental Care, that's up around $405,000. And that's consistent with the increase in funding that was received for this program as well. Healthy Babies, Healthy Children, it's down around $95,000, excuse me. And again, this is just consistent with funding that's received. School Focused Nurses Initiative, again, it's down about almost in half. And this is just consistent with a decrease in funding received. Infection Prevention and Control Hub, it's down around $286,000, mainly due to a decrease in salaries and benefits of around $204,000. Miscellaneous grants, you can see a large decrease from $880,000 to $98,000. And again, that's just mainly due to the isolation center, along with some other items related to COVID community clinics and rentals and things like that, that really didn't occur as much in 2023. The rest of the lines, starting with adult dental and unorganized, are quite consistent with budget and with the prior year. And the last one really is the one-time programs at the bottom. It's lower than budget and lower than the prior year. And again, last year there were some bonuses that were required to be paid with one-time funding that were included in that line. So all said and done, once we get down, this year there's a surplus before the undernoted items of around $930,000. That compares with a surplus last year of $1.7 million. The big difference here being that only $635,000 is being used to settle Province of Ontario settlements, whereas last year there was $1.8 million that had to be sent back. So at the end, last year there was a deficiency or deficit of $107,000, and this year there's a surplus of approximately $282,000. I'm not going to go through the balance of the financial statement, if that's all right. Really, a lot of it is just more detail if the accounting policies are not changed. And every note goes through more detail of what I've already gone through about additions, for example, on the capital, and then more details of what your accounts receivable are. And the important thing to do is when you're looking at these statements is when you get to the back, every program has its own schedule, which shows its revenues and expenses. And I believe there's 11 schedules here, which detail everything from both your public health mandatory programs, healthy babies. So again, is every program that you has its own revenue and expense schedule to give you more detail than the broad categories on the statement of operations. So that's really all I have for today. And again, more than happy to try to answer any questions you may have.
Have any questions? Oh, Morris, go ahead.
I don't know if my camera's on. Am I on?
Your screen is frozen.
Frozen?
Maybe.
We're just encountering a little bit of technical difficulty. Just
Yeah.
a moment there.
We got somebody. Where did it go? Well, it's there. And Here we go.
There we go.
perfect.
But can you hear?
Yeah.
There we go. Thank you. Thank you.
Oh, your speakers, huh?
Yeah,
Speakers by speaker.
Yeah, no,
No.
leave that off.
Keep it off.
Is the sound.
Okay. Okay, we okay?
Yeah.
Okay. Derek, thank you for your work. I had a query not about specific numbers, but I'm curious if in your work, in your practice, you are using anything that could be construed as artificial intelligence. Do you foresee that happening if you're not doing it now? And if it's going to be used, will you have to declare it in your work that you present for clients?
Yeah, very interesting, very good question. No, at this current time, we are not using AI in any of our audit work. We actually are going to be having a mandatory session for partners in July, talking about the potential future use of AI in our audits. So yes, I will be able to, let's just say, perhaps at the next time we get together, I'll have a little bit better understanding of what the firm's potential use of AI going forward is. But currently, we do not use AI on any of our audits. And as I'm aware at this point, we're not scheduled to use any in the next year. But I'll have a better understanding come July.
Thank you.
Any other questions from anyone? Any little doubt or hesitation or thought? No? Anyone online? Jamie? If anyone else has joined us? You have any questions? No, you're good? Okay. Well, with that, I would like to thank you for the presentation today, Derek. Much appreciated, and all the work that you've done to get us to this spot and probably continue on for a little bit further. So thank you.
Well, you're quite welcome. And if I just may say, you have a great team to work with, and it's always our pleasure to work with them.
Thank you. And another thought would be to Isabel and her staff for consistently doing excellent work.
Excellent.
Clean audits and all the rest of it. We would expect nothing less. And I know neither would you.
But I
So, right? So no, thank you. And please be sure to share that with the staff as well. So thank you both.
Take care,
Thanks.
everyone. Have a great balance of your meeting.
Thank you, Derek.
Okay, bye now.
Bye-bye. Enjoy your evening.
I will try. Thank you. Accountants and tax season.
On to the next one.
Bye now.
Yeah, take care. Okay, so let's move on to the next item on our agenda. It's the approval of the minutes from our March 6th, 2024 Finance and Property Committee meeting. And I am looking for a mover and a seconder. Blair, move, and someone will second. Him? Yahoo, thank you. Be it resolved that the minutes from the Finance and Property Committee meeting held on March the 6th, 2024 be approved as presented. Were there any errors or omissions noted or brought forward? Nope. Hearing none, go to a recorded vote. Rick?
Yes.
Karen?
No.
Not here, no. Blair?
Yes.
Tim?
Yes.
Sarah?
Yes.
Jamie Lowry?
Yes.
Jamie McGarvey?
Not yet.
Not
There,
here yet.
Jamie Restool?
Yes.
Myself, yes. Morris?
Yes.
Dave Wolf?
Yes.
Catherine Still?
Yes.
Miss carried. Date of the next meeting will be June the 26th, so I'm giving everybody a month off. You don't have to have another one of these meetings
Thanks, Marianne.
another month because everybody's working.
So generous.
The time and location to be determined. There was no business arising. And moving on to new business, which is our 2023 year-end audit. So I have a motion here that was included in your package. And maybe Isabel, would you like to speak to that? It has to do with the amount being transferred to our municipal reserves.
Correct. So there's $77,000 of municipal surplus this year, and it amounts to approximately 15,500 left over from the adult dental program, and 61,000 from mandatory programs. You'll recall when we adjusted the budget in September or sometime like that this year, the provincial funding was less than what we had originally budgeted for, so the municipal share went down. So that's the amount essentially, because there's very little actual surplus in the document other than that. So that the two numbers together add up to the $77,000. I will draw to your attention. I made a note here and I can't get there because it's too many pages back, but it's on page 9 of the financial statements. The balance in the municipal reserve at the end of December was $2,174,000, actually $175,000. And that amount, this year there was almost $100,000 worth of interest earned on the reserve, plus this 77,000 is part of that total. So that's all I have on this.
Any questions, comments, discussion? No, we'll just sock our money away. Okay, so I'm looking for someone to move this resolution. Jamie Lowry
That's two.
Jimmy Restool's online.
and Jamie Restool. Right on. Okay, I will read the motion. Whereas on June the 25th, 2008, the Board of Health for the North Bay Parry Sound District Health Unit approved a municipal reserve fund be established. And whereas on September the 26th, 2012, the Board of Health by resolution removed the cap from the municipal reserve. And whereas on April the 24th, 2024, the Finance and Property Committee of the Board of Health reviewed the North Bay Parry Sound District Health Unit draft annual audited financial statements for the year ended December 31st, 2023. Now, therefore, be it resolved that the Finance and Property Committee recommends that the Board of Health for the North Bay Parry Sound District Health Unit approve the transfer of funds from the Health Unit general account to the municipal reserve in the amount of $77,211. And further, be it resolved that the Finance and Property Committee recommends that the Board of Health approve the North Bay Parry Sound District Health Unit audited financial statements for the year ended December 31st, 2023. And furthermore, be it resolved that the annual audited financial statements for the North Bay Parry Sound District Health Unit, which includes a note outlining the transactions of the Municipal Reserve Fund for the year end December 31st, 2023, be forwarded to member municipalities. No further discussion? Go to a recorded vote. Rick,
Yes.
Karen, oh, she's not there. Blair,
Yes.
Sarah,
Yes.
Jimmy Lowry,
Yes.
Jamie McGarvey.
No.
Jamie Restool,
Yes.
myself, yes. Morris,
Yes.
Dave,
Yes.
Tim,
Yes.
Catherine.
Yes.
Motion is carried. We have no in camera. And so therefore that concludes our exciting agenda for today for the Finance and Property Committee meeting. And I will hand it over to our chair, Rick Champagne, for the remainder of the meeting.
Thank you for those great words. So at this time, we're going to talk about the Personnel Policy Labor Employee Relationship Committee. So we need a chair. Last year, I believe it was Jamie Lowry.
Yep.
Okay. Are you still willing to leave your name stand?
Mhm.
Okay. We need a mover and a seconder.
Move.
Marianne and Dave. Before we go for a vote, is anybody else interested in the? No? Okay. Then I'll ask for a recorded vote. Rick Champagne, yes. Blair Flower,
Yes.
Sarah Inch,
Yes.
Jamie Laurie,
Yes.
Jamie Restool,
Yes.
Marianne Sticklin,
Yes.
Morris Switzer,
Yes.
Dave Wolf,
Yes.
Tim Shepard,
Yes.
Catherine Still.
Yes.
Carried. Congratulations.
You were just getting your feet wet. Nice.
There we go.
He needs more room now.
So do we have any, I guess this is for
For sure.
Vice Chair Baker.
the election of a vice chair?
Yes.
Do we have any nominees?
Nominate Morris Switzer.
Okay,
If called, I will serve.
you'll serve,
I will
Laura?
second.
Okay, any other? Anyone else? Okay. Morris. We have a recorded vote after that, so Morris, you're accepting, obviously,
Yes.
and call for a recorded vote. Rick Champagne,
Yes.
Claire Flowers,
Yes.
Sarah Inch,
Yes.
Jamie Lara, yes, Amy McGarvey,
No.
not here, okay. Jamie Restool,
Yes.
thank you. Marianne,
Yes.
Morris,
Yes.
okay. Dave Wolf,
Yes.
Tim Shepard,
Yes.
Catherine Still.
Yes.
Congratulations, Morris.
Congratulations.
I hope so.
Okay, so we have an approval of the agenda. And that it be resolved that the Personnel Policy Labor Employee Relations Committee agenda dated April 24, 2024 be approved. Motion?
Yeah.
Okay. Moved by
Marianne.
Marianne, sorry. And seconder, Dave Wolf. And record a vote. Rick Champagne,
Yes.
Flowers,
Yes.
Sarah Inch,
Yes.
Jamie Lowry, yes. Jamie Garvey's not here. Jamie Restool,
Yes.
Thank you. Marianne?
Yes.
Morris?
Yes.
Dave Wolf?
Yep.
Tim Shepherd?
Yes.
Catherine Still?
Yes.
It's approved.
Yes.
Any conflict of interest to be declared? Seeing none? Approval of previous minutes. Let me read the motion. Let it be resolved that the minutes from the Personnel Policy, Labor and Employee Relations Committee meeting held on August 16th, 2023 be approved as presented. Moved by Sarah? You? Second by? Oh, Tim? Okay. Tim. Call for recorded vote. Champagne?
Yes.
Claire Flowers? Sarah Inch?
Yes.
I do support as well. Jamie McGarvey's not here. Jamie Orstool?
Yes.
Thank you. Marianne?
Yes.
Morris?
Yes.
Dave Wolf?
Yep.
Tim Shepherd?
Yes.
Catherine Still?
Yes.
That's carried. Okay. Be resolved that the in-camera minutes from the Personnel Policy, Labor and Employee Relations Committee meeting held on August 16th, 2023 be approved as presented. Do I have a mover? Catherine? Seconded by Rick? Call for recorded vote. Rick?
Yes.
Blair?
Yes.
Sarah Inch?
Yes.
Jamie S. Here. Jamie Orstool?
Yes.
Thank you. Marianne? Morris?
Yes.
Dave Wolf?
Yes.
Shepherd?
Yes.
Catherine Still?
Yes.
That's carried. The next date of the meeting is scheduled for September 25th, 2024. Time to be determined and place to be determined. And for that, business arising. Thank Dr. Zimbalati for a clean audit and no shenanigans.
Yeah. Joaquin, I know you're busy, but you did a great job.
Those are the shenanigans, right? And there's no in-camera compliance. My favorite word.
You're welcome. Hear about the shenanigans.
Under new business is the creation of an ad hoc committee for the performance evaluation of the medical officer of health, executive officer of North Base, Sound District Health Unit. There's a briefing note. Okay. So, can we go right to this? Or how do we, are we setting up, or are we setting up, or do we go to
Jose,
Jose?
yeah.
I can start.
Can you start it?
Yeah.
Okay, that'd be great.
All right. So thank you for having me here. I think it's been a little while since I've been here. So, so there is a briefing note attached, and bring it up here. So I'm not going to go through it line by line because you probably had the opportunity to read through it. But basically, the purpose is that the issue is that we need to conduct a performance evaluation on our medical officer of health. So because it's part of our process in our roles and responsibilities of the board, and so this recommendation is to create an ad hoc committee of the board that would be made up of the chair of the board, also the chair of PPLER, and we would form an ad hoc, and myself, and we would form an ad hoc committee to develop the survey to to get some feedback from a large number of people, which we would discuss at our meeting about that. And so, yeah, and it would, and just to give you an idea, it would cover Board of Health members of the community partners. So that is the purpose. So really today is just to confirm who will be on the committee, and we will have separate meetings.
Is there a preferred number for that?
For the ad hoc committee, so the recommendation is to have just the chair of the board as ex officio, the chair of PPLER, which we were selected today, and then myself. But if the board would like to add other members, that's always an option as well.
Okay.
So
Anyone interested in being part of that ad hoc committee?
What is the frequency of the meetings and?
So I would expect we would meet probably the first time just to confirm the tool, who we're serving it out. A lot of the work I would end up doing by sending it out to get the feedback, and then the information would come back. So I would say probably two to three meetings, and then just keep in mind there would be a meeting where the information is brought back here and in camera, and so that way all members, would get a summary of the responses. So it's an estimate about 3 meetings, but sometimes things take a little. Either meetings we might need subsequent meetings, but that's what I estimate based on what we've done in the past. And I mean, there's flexibility depending on the members when we would meet, whether it's in the evening or.
Have you done this previously?
We have done this previously, and so we have a lot of things already in place. So I expect it's going to be less work than when we first implemented it.
Correct me if I'm wrong, but I think it was just the 2 chairs that were there.
Yeah, the last time, yes, that's correct. The more people you have, the more difficult sometimes it can be to
Certainly
dates and times to meet. But we're open to, whoever or the number. That's why we just suggested 2, but it can be more.
Well, if it's easier for you to make decisions with the 3, maybe that makes sense. Unless someone has a strong interest in that. Enjoying.
Okay.
That makes good sense.
Yeah, I mean, all the information will come back.
Yeah.
That's correct. It's come back.
Facilitating the process to get it
Yeah.
come back to the board.
Super.
Okay. Should I read this whole? Okay, where Dr. Carol Zimbalati was appointed as the full-time medical officer of health and executive officer, the North Bay Parry Sound District Health Unit by the Board of Health effective July 11, 2023, and whereas the Board of Health is responsible for conducting a performance evaluation for the medical officers of health and executive officer MOHEO, as outlined in section 4.1.4, I'm going to say that's a Q, barring dirty glasses, of the Board of Health Policy BG008- roles and responsibilities of the Board of Health and individual members of the Board of Health. Therefore, be it resolved that the Personnel Policy, Labor and Employee Relations Committee recommend the Board of Health approve the creation of an ad hoc committee of the Board of Health called Medical Officer of Health Performance Evaluation Committee, which is comprised of the chairperson of the Board of Health, officio, chairperson of PPLER, and the executive director of Human Resources. Furthermore, be it resolved that the Policy, Labor, Employee Relations Committee recommend the Board of Health approve remuneration for this activity in accordance with the Board of Health Policy number BF004- remuneration Board of Health members. Do I have a mover? Marianne? Seconder? Morris? Okay. We'll call for a recorded vote. Champagne?
Yes.
Claire Flowers?
Yes.
Sarah Inch?
Yes.
Jamie Lowry, yes. Jamie McGarvey's not here. Jamie Restuel?
Yes.
Thank you. Marianne?
Yes.
Thank you. Morris?
Yes.
Dave?
Yes.
Tim?
Yes.
And Still?
Yes.
That's carried. And now I call for an adjournment. I'll pass it over to, whoop,
Bye.
okay. Leafs are starting in a few minutes, so
Hurry up.
if I have to. Thank you.
Thank you.
Thank you, Jose.
Thank you, Jose.
right, thank you, everybody. We're going to go into our main meeting. We'll call it to order. I got approval of the agenda, but I have a recommendation 10.4. More Switzer would like to speak on some indigenous issues.
I can speak after the MOH report, I think. Eh?
Yeah, under new business.
Oh, okay.
Yeah, that's you want to speak about, right?
Yeah.
Okay, thank you. So yeah, with that item added on, I need a mover and a seconder. Moved by Catherine. Second by Blair Flower. Oh, sorry, I got Blair first. Sorry. Sorry, Jamie.
He doesn't care.
That's for recorded vote. Champagne, of course, yes. Karen, no. Blair Flower.
Yes.
Sarah Inch.
Yes.
Jamie Lowry.
Yes.
Jamie Restool.
More consistent. Right.
Mary Ann Stickland.
Yes.
Boris Switzer.
Yes.
Dave Wolf.
Yes.
Tim Shepard.
Yes.
Catherine Still. Carried.
I say no.
Right. Conflict of interest, something comes up, just let us know. Approval of the previous minutes. Need a mover and a seconder. I will take Jamie Restool. Second by Dave Wolf. Any discussions on this motion? No? Okay. I'll also record a vote. Rick Champagne, yes. Blair Flower,
Yes.
Sarah Inch,
Yes.
Jamie Lowry,
Yes.
Jamie Restool,
Yes.
Mary Ann Stickland,
Yes.
Moore Switzer,
Yes.
Dave Wolf,
Yes.
Tim Shepard,
Yes.
Catherine Still.
Yes.
Carried. Next item is 4.1, Board of Health minutes. No, we did that one, right?
Yep.
Oh, sorry.
Me too.
Camera, in camera.
Oh, yes.
Camera.
Yeah, 4.2.
Two.
That's not what it says here, though.
Yeah, that's the one.
Oh, in camera. Sorry, I apologize. Move my finger out of the way. I'll see it. Okay, so we needed a mover for in-camera minutes from the Board of Health meeting held on April 17, 2024 to be approved as presented. Mover. Dave Wolf. And Sarah Inch. Any discussion on the motion? No, well, that's for a recorded vote. Rick Champagne, yes. Blair Flower,
Yes.
Sarah Inch,
Yes.
Jamie Lowry,
Yes.
Jamie Restool,
Yes.
Mary Ann Stickland,
Yes.
Laura Switzer,
Yes.
Dave Wolf,
Yes.
Tim Shepard,
Yes.
Catherine Still, carried. Date of the next meeting, June 26, 2024, and I'll also give you a month off.
Aw, thanks, Rick. What a guy.
Okay, then we go new business. Adoption of the board governance documentation reference memo. I'll have a mover and a seconder, then we'll discuss it. Against Mary Ann. Second by Tim Shepard. Whereas September 27th, 2023, a presentation on new governance documentation system was received and accepted, and whereas the memo attached to the Board of Health bylaws, governance manual, code of conduct were distributed on February 23rd, 2024 for review. So to be resolved that the Board of Health of the North Bay Parry Sound District Health Unit approves the revised bylaw as distributed. Any discussions on this motion? I see none. I'll have to record a vote. Rick Champagne, yes. Karen no, Blair Flower,
Yes.
Sarah Inch,
Yes.
Jamie Lowry,
Yes.
Jamie Restool,
Yes.
Mary Ann Stickland,
Yes.
Moore Switzer,
Yes.
Dave Wolf,
Yes.
Tim Shepard,
Yes.
Catherine Still.
Yes.
Carried. Okay. Report of the medical health officer,
Yeah, thanks.
Dr. Zimbalati.
It is, it's a package. I don't have a lot to add for a change. Some updates to it this time, but I'm happy to happy to hear any questions.
Well, mine was just about the fentanyl strips. We had a brief conversation. It's a pretty topical thing, giving.
So we did recently learn that the Ontario harm reduction program is going to be allowing us to order test strips for 3 different substances, including fentanyl, benzodiazepines, and xylazine. This is to be distributed for drug testing purposes. And so it's, from what we know, it's a pull model. We order them rather than they're distributed to us. And so we're at this time really assessing what the needs will be and in terms of how many to order. We have some details yet to learn about how the kits come. It seems there will be some assembly required. So we'll have to work through that in terms of staffing. I'd say at this point, it's, it's a trial. I think the evidence behind self-test kits like this, as we're responding to an emerging situation, there isn't a lot of evidence behind this sort of strategy. There is, some potential for unintended harms in terms of the usage of the strips, but overall, I think it's worth implementing and then evaluating.
I just found it interesting that the potential negative consequences, like people could use it as if I'm getting this right, use it as a sorting way to find out the one they actually want, which which could be harmful as well. So I think it's a caution thing because it could also have unintended consequences that could be, I don't know.
Yeah, I think more information to the user so that they can, as much as possible, set up their own safety parameters for how they use that can be of benefit. And like I said, once it's implemented and we see what impact it's having, positive or negative, then perhaps we can evaluate that and perhaps adjust improvements if necessary.
Is anyone else doing it yet, or this is all new?
I believe it is very new that we're able to order. I don't know if other health units have placed an order yet, but in terms of implementation, it would be very, very early days. There are other sites, in safe consumption sites, such as in Toronto, where they do drug testing, but it's on a more on a larger scale where they're actually testing for more than just 3 substances. And so that sort of surveillance is very useful to know what is in the drug supply so that we can, effectively advise the public as to, new substances being present in the drug supply and appropriate precautions to take with that knowledge. So this type of testing kit where it's basically a yes or a no for 3 different substances won't give us that level of detail to make really those types of recommendations. But as I said, I think it is worth implementing and then seeking the feedback on how this is impacting people who do use drugs.
And the only other question I had was, does this put the health unit in a, is there some liability if it turns out we say yes or it says no, and then it actually, there's something else that isn't being tested for, take it and then it's harmful.
I mean, that's
Like-
always like it's testing for fentanyl, but there's so many different fentanyl analogs, and a lot of the analogs are quite a bit more potent. And is it going to test for all of the analogs of fentanyl? Probably not. So there are risks, and so there would be caveats to explain when handing these out, and I think that's all part of the evaluation.
Okay. Thank you.
Good information.
One question myself was, do we still follow the COVID cases? How many there is in our district? Do we still follow that?
So we have limited data on that because really the only areas that are testing right now are highest risk settings such as long-term care, hospitals, even retirement homes. Sometimes that's just by like a self-test kit, right? So not fulsome information. So we do have the number of cases in those sort of facilities. We're not seeking or getting reports from the public on results of their self-test kits. So the data that we have on COVID numbers is very limited. We still do get reports on wastewater. So that can give a more population level idea of what might be happening, but it is very an inaccurate science at this point in terms of understanding how the fluctuations in wastewater levels of COVID sample or signal, how those actually reflect numbers of cases in the community because of the way, with spring runoff, for instance, that can impact the thing. So it gives you a sense, but right now we definitely don't have the level of data that we did at the height of the pandemic. And I don't know that at this point that we need it because it's not really going to change what we're doing in terms of interventions. If there is a major signal we're seeing in terms of our sentinel sites, in terms of long-term care, in terms of hospitals, or if we're seeing huge big spikes in wastewater and it's, kind of across the board or in certain, broader geography, then that might signal something different. If we're seeing sudden increase in morbidity, mortality, then, that might signal the need for a different type of response.
Well, thank you very much. Any other questions for, go ahead, Jamie.
Just that we talked a little bit about the Icelandic partnership with the city of North Bay. Is there an update on that? Have they signed I'm there, but I haven't, my understanding is they don't need a council resolution to sign it. The director of community services has the authority to sign that.
We're in conversations. We don't have a signed MOU for this year at this point. Louise, did you have something to add on that?
I just followed up today and I believe it's in the works.
Okay. I did ask some questions, so that's not surprising.
Okay. I'll read between the lines. Any other questions for Dr. Zimbalati? I see none. Okay. We'll move on to board committee report. The first one is 8.1. I need a mover and a seconder. Okay, Sarah Inch.
I'll second.
Tim Shepard. Okay, whereas Dr. Zimbalati was appointed as a full-time medical officer of health executive officer for the North Bay Parry Sound District Health Unit by the Board of Health effective July 11th, 2023. And whereas the Board of Health responsible for conducting and performance evaluation for the Medical Officer of Health Executive Officer, MOH, EO, as outlined in section 4.1.4Q for the Board of Health Policy BG008, roles and responsibility of the Board of Health, individual members of the Board of Health. Therefore, to be resolved that the recommendation of the Personnel Policy Labor Employee Relation Committee that the Board of Health approve the creation of a ad hoc committee of the Board of Health called the Medical Officer of Health Performance Evaluation Committee, which is comprised of the chairperson of the Board of Health ex officio and chairperson of the PPLER and executive director of human resources. Therefore, to be resolved that the recommendation of the Personnel Policy Labor Employee Relation Committee that the Board of Health approve remuneration for this activity in accordance with the Board of Health Policy BF 004 remuneration Board of Health members. Any discussion on the motion? I think we did this already, and it's left a recorded vote. Rick Champagne, yes. Claire Flower?
Yes.
Sarah Inch?
Yes.
Jamie Lowry?
Yes.
Jamie Restool?
Yes.
Marianne Sticklin?
Yes.
Maurice Switzer? Dave Wolf?
Yes.
Tim Shepard?
Yes.
Catherine Still?
Yes.
Carried. Next item is Finance and Property Committee, which is item 8.2. We need a mover and a seconder. Dave Wolf. Need a seconder? Marianne Sticklin. Okay. Where, as of June 25th, 2008, the Board of Health of the North Bay Parry Sound District Health Unit approve a municipal reserve fund be established. And whereas on September 26th, 2012, the Board of Health resolution removed the cap of the municipal reserve. Whereas on April 24th, 2024, the Finance and Property Committee of the Board of Health reviewed the North Bay Sound District Health Unit draft annual audited financial statements for the year ended December 31st, 2023. Now let it be resolved that the recommendation of the Finance and Property Committee that the Board of Health of the North Bay Parry Sound Health Unit approve the transfer of funds from the Health Unit General Account to Municipal Reserve in the amount of $77,211. And furthermore, be resolved that the Board of Health approve the North Bay Parry Sound Health Unit audited financial statement for the year ended December 31st, 2023. And furthermore, be resolved that the annual audited financial statements for the North Bay Parry Sound Health Unit, which include the note outlining the transaction of the Municipal Reserve Fund for the end of December 31st, 2023, be forwarded for the members of the municipality. Any discussion on the motion? I see none. I'll ask for a recorded vote. Rick Champagne, yes. Claire Flower.
Yes.
Sarah Inch.
Yes.
Jamie Lowry.
Yes.
Jamie Restool.
Yes.
Marianne Sticklin.
Yes.
Maurice Switzer.
Yes.
Dave Wolf.
Yes.
Tim Shepard.
Yes.
Catherine Still.
Yes.
Carried. Thank you and great work. Correspondence, new business. 10.1 Associated of Local Public Health Agency Annual General Meeting and Conference Notice.
Yeah, so there is the meeting being held in Toronto, June 5th through 7th. You've had the information on this sent to you, so it's up to the board to decide how many members we would like to send, and then individuals interested in the executive assistant know.
I'll just let you know if I decide I'd like to go also. I don't know if anybody else on the board wants to go, but okay. Thank you, Doc.
Have to set a limit on the number of
How many?
attendees.
Exactly.
So how many traditionally or historically would have gone?
Typically 2 we've, but sometimes I think it's been approved for as many as 3, but I don't think 3 attended, so.
Okay. So we need to decide tonight the number that we would approve to go, right?
Exactly.
Max. Yeah, the maximum.
The maximum, what do you say, a maximum of 3?
Sounds fair.
Okay, I'll put down a maximum of 3, then we'll let you know if who's interested. Okay.
First 3 through the door.
All right, there's no motion for that, of course, yet.
I believe there is.
Yeah, there is. You have to.
Oh, there is too, isn't there?
You were so close, Rick.
Another one.
I flung the page. It was two of them stuck together. I apologize.
Fingers.
All right, need a mover and seconder. Moved by Catherine Steele. She is here.
Shut your gob. I am here.
Second by Dave Wolf. Let it be resolved that the Board of Health of the North Bay Parish Sound Health Unit authorize 3 board of health members to attend the Association of Local Public Health Agency, ALPHA, 2024 to the annual general meeting conference held on June 5th to the 7th at the Pantage Hotel located at 200 Victoria Street in Toronto, Ontario. Furthermore, to be resolved that the expenses related to the attendance of ALPHA 2024 annual meeting at the conference be paid in accordance with the Board of Health Remuneration Policy BF004. Any discussions? No. All right. So let's record a vote. Rick Champagne? Yes. Blair Flower?
Yes.
Sarah Inch?
Yes.
Jamie Lowry?
Yes.
Jamie Restool?
Yes.
Marianne Stickland?
Yes.
Maura Switzer?
Yes.
Dave Wolf?
Yes.
Shepherd?
Yes.
Catherine Steele?
Yes.
Carried. Now we get to the next one. And point 2, restricted youth access nicotine pouches. I'll ask for a mover and a seconder, and I believe you're speaking on it, right?
Yes.
Okay. Need a mover? Sarah Inch. Did I see your hand go up, Jamie Restool?
There it is. There it is. That's a clever way of
Yes, you
doing it.
did.
Discussion on this motion.
Thank you. So nicotine pouches under the brand name Zonic have been approved as a smoking cessation aid under the Canadian Food and Drug Act as an authorized natural health product and are being sold in various retail settings throughout Ontario with no regulated age restrictions and minimal advertising restrictions. The use of colorful packaging, Powerwall advertising, campaigning, and then multiple flavors that this product is offered in make it highly appealing to youth. Nicotine pouches fall outside the scope of the Federal Tobacco and Vaping Products Act, and as well our provincial Smoke-Free Ontario Act, which regulates tobacco and vaping products by restricting their advertisement, promotion, and youth access. Within the district served by the health units, Zonic is available for purchase at about 50% of the stores inspected by our health unit tobacco enforcement officers, including all the major convenience store chains. In March, Health Canada issued a statement and public advisory acknowledging concern about nicotine pouches becoming popular with youth, and then subsequently released a notice of intent to explore legislative and regulatory options to protect youth from risks associated with this product. At a provincial level, other provinces such as the British Columbia and Quebec have amended their provincial drug schedule regulation earlier this year and now require nicotine pouches like Zonic to be kept behind the counter at a pharmacy to prevent misuse, especially among youth. In the attached briefing note that was in your board package today, we have presented 2 recommendations to take immediate steps to restrict youth access to these products until the regulatory gap is closed. One of those recommendations relates to the provincial government and the other relates to the federal government.
Discussions on the motion, other than
I think it's incredibly important to try to regulate it. And speaking as a parent, you know, I'm aware that kids get up to all kinds of things. And I heard about this earlier in the year, in the fall, that it was being a trend. Yeah, happy to support this motion.
Okay, well then, I'll read the motion. Moved by Sarah, second by Jamie. Whereas Canada approved Zonic nicotine pouches as a smoking cessation aids under their natural health unit designation. Whereas nicotine pouches sales have now age restriction and minimal advertising restriction as they are outside the scope of the Federal Tobacco and Vaping Production Product Act. Whereas Imperial Tobacco, the maker of Zonic, are using marketing tactics such as Powerwall display on convenience stores, colorful packages, and fun flavors to attract the youth. Whereas the nicotine is highly addictive and can permanently impact the development brain of a youth and young adults. Whereas Zonic has been sold throughout Ontario in various retail settings, has been since October of 2023. Therefore, let it be resolved that until the federal regulation gap closes between the Board of Health urges to Ontario government to take immediate steps to restrict youth access to these products by amending the provincial regulation to require that nicotine pouches like Zonic be available for purchase at pharmacies and kept behind the counter. Further be resolved that until the regulator gap closes between the Board of Health urges to the federal government to take immediate steps to restrict youth and access to these products by A, suspending the sale of nicotine pouches or reclassifying nicotine pouches, including flavored pouches, as a prescription product available only behind the counter and pharmacies, and establish a temporary moratorium on approval of more nicotine pouches products or any new categories of nicotine products under the Natural Health Use Production Regulation unless the product are sold on prescription basis. And furthermore, resolved that the Ontario Board of Health provide correspondence of these resolutions in district and municipalities. Other boards of health, Vic Fideli MPP, Nipissing, Graydon Smith MPP, Parry Sound, John Van Toff, Timiskaming Cochrane, the Honorable Doug Ford, Premier, the Honorable Sylvie Jones, Ontario Minister of Health, Ontario Local Public Health Agencies, Alpha, Scott Aitchison, Parry Sound, Anthony Rhoda, Nipissing, Timiskaming, and the Honorable Mark Holland, Federal Minister of Health. I believe that's it. We're going to record a vote. Rick Champagne, yes. Blair Flower. Sarah Inch. Amy Laurie.
Yes.
Jeremy Restool.
Yes.
Marianne Sticklin. Maurice Switzer.
Yes.
Dave Wolf.
Yes.
Tim Shepard.
Yes.
Catherine Still.
Yes.
Carried. It's a mouthful. I apologize for that. All right, the next one is the, I'm missing one here, so.
Motions are done.
No, the motions are done, okay. 10.4, Morris, you had some discussion?
Oh, thanks. Yeah, thanks, Chair. Every time since I've been a member of the board that I look at the Medical Officer of Health's report, I'm just amazed at the number of lives that this health unit touches. All of the people in our catchment area to be amazed. And we understand that the health unit has just gone through or is in the process of going through the strategic planning. And I think there are two areas I wanted to, two opportunities, I think, for the health unit as we go into this new strategic planning period. One item is communications. And I think given issues, for example, like the Planet Youth Initiative, I don't know what plans are in the works, but I think the health unit, it would serve us well and our constituents if we had a summit involving media organizations in the area and who have a vested interest in making sure their customers are healthy. I think we really have to start looking at how we can leverage media. I know that they all are undergoing, capacity problems of their own, but there are lots of really interesting, important stories that we have an opportunity to work with them to share. So I'm hoping that that's something that is part of the health unit strategic planning priorities going forward. The other issue, and the very first sentence of Dr. Carroll's report says that the 2024 Ontario budget was tabled on March 26, 2024. There was only one direct mention of public health relating to investing in Indigenous and Northern public health programs. Well, I'm not delighted that that was the only mention of public health, given that, as opposed to us trying to prevent illness, health dollars are spent on I think a sickness maintenance program, I guess is one way to describe it. But I am pleased that that the province decided to mention the importance of Indigenous and Northern public health initiatives. Healthcare, whether they're child services, there are all sorts of historic reasons why these gaps exist. We're all in a position in this type of agency to do what we can to close the gaps. It's not. We have one employee whose office is designated as an Indigenous engagement coordinator. That's not enough. But that also we also have to move away, I believe, from looking at this organization's responding to the Truth and Reconciliation Commission's health-related calls to action by, instead of making a silo out of Indigenous health, by making sure that this organization has a commitment to reconciliation and to closing those gaps for Indigenous peoples. We have 9 First Nations in our catchment area. There are currently over 7,000 Indigenous peoples, including myself, that make North Bay their home. We contribute $350 million a year to the city's economy. We deserve to be. We deserve to get the kind of health care and education and services that every other citizen does. So instead of looking at reconciliation as again just a silo of what the health unit's doing, I would put it to you that every part of this organization, every part of their input into the strategic plan should have specific reconciliation objectives. I think, and I believe, I don't know whether we should take a look at what our what the overall health unit's mission and vision statements are, but I think it's time in 2024 that all public agencies, in addition to giving a land acknowledgement at the start of our meetings, put those important symbolic gestures to work by including specific reconciliation mentioned in our organization's mission and vision statement. There are many ways to make these things tangible. I noticed in the report the number of staff vacancies. When an organization, when a province, when a country, when its boards and agencies and cabinets, and when they look like the people, the populations they're serving, that's when they're legitimate. I do presentations on treaties, and I start my presentations with a picture of the Fathers of Confederation, 37 white Anglo-Saxon men. I think there's one Catholic in there, actually. 37 white men. That's not what Canada looked like in 1867, and it sure isn't what Canada looks like today. 33% of Canadian citizens were not born in this country. If we don't have boards and for corporate sector businesses, as well as NGOs, as well as public institutions like health units that represent the people that we purport to serve, we're not doing our job properly. And we should be re-examining what we're doing. So the good news is that this health unit has, and I don't believe, by the way, I was referring to vacancies and for hiring practices. I don't believe in quotas. I think quotas are just as offensive to the people who get the jobs as the people who are providing the jobs. That doesn't mean that if you're looking to make your organization stronger and representative, that you shouldn't actively recruit people of different parts of your community populations. That's what many progressive organizations are doing. So the good thing about this health unit is we have some really committed people. I know in Louise's department, there's some really committed people, including Chris Bowes and Jess Love. The person who is the Indigenous Engagement Coordinator, Meg Pollan, is literally overwhelmed with what she feels is an unachievable task, I think, for one person, and she's absolutely right. But reconciliation isn't one person's job. It's everybody's job. It's our job. It's 170 employees' job in this organization. So this community has Indigenous doctors, Indigenous lawyers, Indigenous nurses. There have been 2 Native American astronauts. There is nothing that Indigenous peoples can't achieve without the same opportunities as other people. So I'm hoping as the strategic plan of the North Bay Parry Sound Public Health Unit, is implemented, that it looks at a holistic approach to what some organizations call indigenization. I don't like any word that ends in IZE, but let's say looks at how we can truly make meaningful response to the Truth and Reconciliation Commission's calls to action. We have an opportunity to be a leader in that area, and we're certainly positioned given our geography here. So I want to congratulate the work that's been started here. And I want to thank the doctor for all the leadership that she's shown in these files. And as a member of the health unit, I'm glad to support anything done in this regard. So, okay.
Thank you for the words, Morris. Life is changing, and so is everything else. I just come back from a conference, and I used to hear the national anthem sang French and English. First time that we were representing 440 municipalities, also Indigenous also. So there was the 3 languages that they qualified. So it's nice that it's coming, it's revolving. It's going to take time, but again, thank you for those words.
Thank you.
Any other new business? Oh, did I skip over that one again?
Yeah.
Board of Health evaluation.
So this is actually another requirement that the Board of Health conduct a self-evaluation every 2 years. That hasn't happened due to COVID. There's been a pause since 2018 in conducting board self-evaluation, but we do think it's time to reestablish that. And this is really about understanding your needs as a board in terms of, training, in terms of knowledge base, in terms of what staff at the health unit provide to you for you to be able to make your decisions. So there will be a survey that is going to be sent to you in the next couple of days, Monday at the latest. It'll be sent to you, and we're asking that you complete it by May 17th, and that will give us time to review results and then kind of develop a plan around those results, and they'll be presented at the June Board of Health meeting. Any questions or comments on that?
Thank you. I appreciate that.
No cheating.
Lovely idea.
No cheating anybody.
It will be anonymous. Your name will be collected, just so that we know, because it is a requirement that it is done, but that your name will be kept separate from your responses.
I see Jamie McGarvey is on. Did you have anything to say at all, Jamie, or you just popped in? Because we're just
I
about
was
to
in
adjourn, I
A few
think.
minutes ago, but no, I don't have anything right now, Mr. Chairman. No, it's good. Thank you.
Go ahead, Marianne.
I wonder, Jamie, if you wanted to chat a little bit about the opening of your Board of Health office or your health unit office in Parry Sound, and what a lovely place that is.
If you want me to, we're extremely pleased that the health unit is expanding its services and found a new location that I think really makes the community proud, and the employees of the health unit in Parry Sound proud as well. They seem all very pleased with the facility, how it functions. Well, there's a few little glitches, but it's nothing that can't be worked out. But it's a great facility. It was a great ribbon cutting ceremony, and there were a number of board members there, and the chair was there as well. It's great. We're very pleased with the facility, and certainly the new expanded role of the health unit within the community in the West Parry Sound area.
Great.
Yeah, you're absolutely right, Jamie. When I went and toured it for the first time, the staff all had smiles on their faces for sure, and really enjoying the new scenery and the new office for sure. Long time waiting.
Yep, it's great. And the roof doesn't leak.
Thank you, Jamie.
You're welcome.
We have nothing in camera. Okay, before the adjournment, not sad news, but the young lady beside me is moving on. Nellie's last meeting with us, and she's getting closer wants to go closer to family, so she's gonna move on, which is, it's nice though. We enjoyed your time with us, and
Thank you everyone. I mean, it was really great working with all of you. Initially when I came, I was a little scared. Board members means like, oh, they're going to be tough.
They're bad.
And thanks for breaking the ice. You made me feel so comfortable. I mean, it was just like talking to another colleague. So supportive, Rick especially, always. And thanks a lot. I look forward for the next opportunity in front of me, and let's see what happens. Stay in touch. All the best to all of you.
Best wishes to you.
it's just to you too. No?
Thank you so much.
Just time and opportunities, so we never stop growth for sure. You enjoy wherever your next steps will be. So thank you from the board.
Thank you so much.
So I'll have an adjournment now, please. Media, okay. So good night, everybody. Thank you very much, and enjoy the rest of the beautiful day.
Insist.
Not
Take
snowing.
care.
Thank you, Jamie. Thank you, Amy, and thank you, Jamie.
It's not snowing yet.
Jamie?
Thank you, Jamie.
Jamie?
He did,
I'm changing my name to Jamie.
right?